We reach out to our community members to help engage them in to help give them knowledge of what a cataract is, for example, what dry eye is, and what offerings we have to help with those areas. So we're really out there in the community. We actually have a mascot. We have an eyeball mascot that goes out in the community and does some educational things, hands out some educational materials and some giveaways, and we've just always really been engaged with the community. A big part of the reason that we offer these outreach programs are to educate people in a small group setting where they can learn about all the options and they have the doctor there to answer their questions, where when they're in an exam lane, the doctor's hustling from one patient to another. The patients don't really know what questions to ask, or they think about them after they get home. So this affords them the ability to sit in a relaxed environment and have their questions answered.
Welcome to season 3 of the Ophthalmology Experience powered by Boost Patients. Today we're joined by Debbie Davis. Debbie is the CEO of Atwal Eye Care, where she has been leading the organization for nearly 38 years. Over that time, she has helped shape a practice deeply rooted in patient care, community impact, and steady innovation. Her leadership is driven by a clear commitment to creating meaningful experiences for patients while continuing to evolve and stay connected to the needs of the community. Debbie, welcome to the show.
Thank you very much. Thank you for having me.
Yeah, and right before we got started, I was asking you, where your practice was, and you told me Buffalo, New York. So is it still pretty
Yes.
chilly up there?
It's about 20 degrees today. Yes,
Okay.
still chilly, lots of snow piles, but spring is on the way, so we'll be enjoying spring soon.
Yeah, it's been a very odd year. It feels like, but you know, for us especially, we're at almost 80 today, and you're at 20. So it's
Wow. I want to
so,
be where you are.
um, and so yeah, thanks again for joining and reading your intro too. 38 years is pretty
Mhm.
impressive.
Yes, long
I think
time.
you must have a very good level of patience and uh, just fortitude to be able to
Yeah.
last so long.
Yeah,
Because
I've
the
seen it
role of an
all.
administrator, yeah, the role of administrator is just it's really tough and it's really rewarding. But I congratulate you on that. That's
Thank
quite an
you. Thank you.
accomplishment. And so, being in ophthalmology or being at this practice that long, have you always been in ophthalmology? Is that where, or what's
Yeah,
your
that's where
story?
I started my career. Yes. I started with Dr. Amar Atwal, who was the only provider at the time. It was me and two other people in the office, and very, very small office, 2 lanes. And he did surgery in a hospital outpatient facility, and he had this dream of opening a surgery center. So while I worked for him the first few years, he applied for his CON because we're a certificate of need state,
Mhm.
and he was approved. We're one of the first Medicare and state approved, privately owned ASCs in the area. And we now have 5 locations. We have a 7 operating room ASC. We have a vision correction center, dry eye clinic, opticals, and 15 providers.
That's awesome. That's awesome. Yeah, I've heard about the different states with the need and the CON states, and
Hmm.
in our state we're not, and we personally have been getting into OBS. We have some
Right.
ASCs. We also have an OBS, and it's seems like each serve a purpose and a role. Have y'all thought about that at all? Or,
Yes, yeah, we absolutely have. We actually just are in the process of building out an OBS suite in our clinic, which is in the same building as our ASC.
Mhm,
But what we plan on doing with that is using that space for our EVO ICL patients. So they're getting more of the refractive experience that our LASIK patients have, and possibly doing some minor procedures out of that room.
yeah. Yeah, it definitely gives a practice flexibility, and that's
Hmm.
been our experience over the past few years. So
Yeah.
that's really cool. So I guess you've probably seen and done a lot over your tenure there. And you've grown to 5 locations, and you have all these different specialties that you're growing. In that, I'm sure you have to do a lot of outreach You have
Right.
to connect with the community, connect with referring doctors and referring optometrists and everything else, and patients that are may not be aware of you. And so I'm sure that's been a big part of your journey as you've grown to where you've come from. So just before, I want to ask you some questions about that because since you've been with the practice so long and have seen the transition and that growth of, but what when I say the word community outreach, like what does that mean for you? Like how would you define that when it comes to your
So
practice?
I would define it as, we reach out to our community members to help engage them in to help give them knowledge of what a cataract is, for example, what dry eye is, and what offerings we have to help with those areas. We also do. We've always been a really, really big community organization and company. We actually trademarked the name hashtag the 716. So 716 is our area code. So we're really out there in the community. We actually have a mascot. We have an eyeball mascot that goes out in the community and
Okay.
does some educational things, hands out some educational materials and some giveaways. And we've just always really been engaged with the community. And, we're kind of in the heart of the area where our main office is. So it's really fulfilling to be able to educate these patients. And I think really where it started was when we started having when premium IOLs came into place. So, for a long, long time, we had a monofocal lens, and that's all you can get. And you came in and you said, I was referred by my doctor and I need cataract surgery. And it was, you have your A scan done and you scheduled a procedure. Now it's a lot of education for the patients on all the advanced technologies out there. And when you come to a consultation, a cataract consultation, and you are here usually for an hour and a half, 2 hours, and you're given all of this information, it's really hard to absorb in one sitting. So, a big part of the reason that we offer these outreach programs are to educate people in a really a smaller in a small group setting where they can learn about all the options and they have the doctor there to answer their questions, where when they're in an exam lane, the doctor's hustling from one patient to another. The patients don't really know what questions to ask or they think about them after they get home. So this affords them the ability to sit in a relaxed environment and have their questions answered.
So in that environment, do you bring a physician normally, or is it you or your staff or the eyeball
Yeah.
mascot?
Yeah, so it depends on what the event is that we're holding. So we always have a physician there. Yes. For our cataract lunch and learns, we have one of our surgeons that does cataract surgery. And depending on the location, so usually, our main office location, we have a large waiting room in our vision correction center, so we use that for the meeting, and we can fit about 50 to 60 people in there. So, it's a nice environment. For that, we have box lunches for the attendees. I talk about the practice a little bit, educate them on the practice, show them a video on cataracts, what a cataract is, and what the options are for cataract surgery. And then after that, the surgeon would come in and introduce himself, and he would answer any questions that the audience may have.
It must be a thing up in the Northeast to do these cataract lunch and learns because I've talked to a couple people who do it. And
Yeah, it's interesting. It's always been very popular in this area. As a matter of fact, so have our vision correction events. So we have what we call sight nights, and that's for vision correction procedures. And I know people, across the country used to do them all the time, but there aren't many practices that still do them and they get a volume of patients. But, I think we're in a unique area where they're interested in coming and learning more. So we still have them every month. And then we also have dry eye events every month. And the dry eye event, we have our dry eye doctor, one of our optometrists. She comes and she does the presentation and talks about our offerings to patients.
now, when you're trying to fill the seats in these events, is it mostly your current patient base, or are you doing pretty heavy external marketing?
Pretty heavy external marketing. It's
Uh,
usually Definitely more new patients than our
Okay.
own established patients.
Uh,
We do get some of our own, especially if they happen to schedule a cataract evaluation. We have an event, a couple days later, we'll tell them about the event and they're welcome to come. But usually we reach out by all different sorts of marketing. We do a lot of Facebook, Instagram. We do YouTube, TikTok. Our TV and radio. We do traditional and we do streaming. So
yeah.
whenever we have, let's say a commercial streaming, and it depends on the audience we're looking at. So cataracts, we still use traditional TV and some streaming. We put a banner on on the bottom of our ad saying that we have an event coming up so that they can call in and schedule.
Mhm.
The social sites, they schedule right through the link and they answer some questions so we have an idea of their age bracket, if they've been diagnosed, for example, with cataracts, for vision correction, how long they've been thinking about vision correction, all those types of questions. So we have an idea of what we're going to have in our group for that event.
And do you find that the patients that have gone through those events, when they come into the office, they're a little bit more informed and are asking the right questions versus patients who come in and have zero idea about a multifocal lens versus a monofocal lens versus laser cataract surgery? Or what do you
Yeah,
see?
absolutely, 100%. They're more educated. Our events are usually typically about 20 minutes talking about cataracts, about all of the lens options. Same thing with vision correction or dry eye. And the rest of it is questions and answers. And it's amazing how many questions we get. And sometimes we're there for an hour answering questions, and the doctor will go as long as he has to go. But, there are questions from really a lot of questions on the differences between the advanced technology IOLs, and then just questions on, what type of anesthesia am I going to have? And those types of questions that you're able to answer in this relaxed setting. They're definitely more educated when they come in. And we found that our tech workup, our doctor time with the patient, our counselor time with the patient is less with those patients that have been to an event.
Sure. Yeah, because I'm sure just like all of us in the industry know, it takes several touch points to
Right.
educate those patients because there's just a lot of information that gets thrown at them. And it,
Exactly.
if you're not familiar with it, it can be very daunting. So,
Right.
um, where do you think, so external marketing in terms of community outreach, how is that prioritized in terms of your growth strategy as a practice? Is it your primary growth strategy or is it just a piece of it? I'm just trying to get a
Yeah,
feel.
it's just a piece of it. Yeah, I wouldn't say it's our primary, but it's a piece of our growth strategy. I will tell you that from our events, the new patients that we get in the door from our events, we
Mhm.
have a very, very high percentage that schedule evaluations from that event. We just had a cataract lunch and learn on this past Wednesday. We had 50 people that attended. We allow people to bring a guest if they'd like. So there were probably maybe 32 prospective cataract patients, and the rest were guests. But about 92% of those patients scheduled an evaluation after. So that's really telling that they know they have cataracts. They're coming to us. We have some patients that come that are scheduled with another provider in another practice, and that's okay with us. We really just want the education out there for the patients. Some of those patients will, they're all very thankful after. They'll say, I'm scheduled with Dr. Smith down the street for next week, and we're very happy for them. And some of them say, we really like your explanation. I didn't even know these options were available. And then they become our patients.
So, what do you think is the biggest draw? Is it the food? Is it the opportunity to talk to the doctor? Which one is that?
Yeah, you would think it's the food, right? Everybody
Huh?
likes a free
Yeah.
lunch, but based on the questions that patients ask and the time that they stay there and that they talk to the doctor after, I think they're craving that education. And I think for the cataract age patients, they do like getting out. And
Yeah.
yeah, I'm sure it's nice that they get out and they go to a lunch, but they really are craving that education and that knowledge. Many of them that come, they say, my friend had cataract surgery by you, and she went to one of your events beforehand, and she, really said how fantastic it was and how much she learned. So I think there really is that education piece. Patients are so much more educated than they ever were. They're, using devices like they never were before. So I think that's why a lot of those social marketing strategies work because they're on their computers
Right.
using those sites.
So, so I guess going along that path, if the value is in the education, how do you when you put it like in Facebook and Instagram and other channels that you're promoting these events, how do you like what verbiage do you use to say, is it really come talk to the doctor or is it like what do those ads look like?
Yeah, they usually, depending on the ad, will say, come to our cataract lunch and learn about all of your options with today's modern cataract surgery or something like that. And yeah, you get to meet the doctor and answer and have all of your questions answered. Our vision correction ones are, learn about all the vision correction options that are available. If you've been told in the past that you weren't a candidate for LASIK, there's other options that may be available to you, things like that.
Right. And I'm sure you've done a good number of these over the years. What are some of the things that you've learned like, okay, I'm not going to do that again, or or conversely, like, oh yeah, this is the thing that if we're not going to do anything, we have to do this one thing. Maybe start with some lessons learned. Like, what are some of the
Yeah,
things
I
that
think one of the things is so when we first started doing them, I did a lot of them outside of the office. So we would go to a restaurant, and we still occasionally do that. But we would rent out some space. We'd have a lunch there. We would have the same exact program, but it would be at a location. And my thought was that that would be more popular. People like going out to a restaurant, but
Mhm.
the reality is the ones that are the busiest are the ones done in our office. So that's one thing, we primarily do them in our office unless we feel the event's going to be so big that we need more space.
Mhm.
So occasionally, we'll have one at a restaurant, especially, depending on what office we're focusing on. One of our surgeons works out of one of our smaller offices, so, it's difficult to have the event there, so we may pick a restaurant in that area.
Okay.
Um, but I don't know, I'm trying to think if there's any other lessons learned. I think, through the years, we have changed our ads. We used to for vision correction, it would be we wanted the word LASIK in there because that's what everybody knew. But now with the decline in LASIK, and some of the bad press it has had, we don't think that that's as big of a draw as we once did. So we're really, you know, shifting to come and talk about our modern vision correction options and not focusing so much on LASIK. So that's one thing,
Sure.
definitely that we've learned.
So is there a particular type of food that, oh yeah, when we serve this, they come in droves? I'm just
Um, no, not really.
I don't
For our
like
lunch events, it's usually a box lunch, and
yeah,
they're
something
happy as can be with that.
yeah,
For the site nights, it's more of a cheese and crackers and little sandwiches. And actually, for our site nights, we have wine and beer available.
right,
And so that it's really does it makes it a much more relaxed environment. And then with our site nights, we also when we have them in the office, we do a live LASIK procedure. So anybody in the audience is able, if they want to, they're able to watch the procedure being done live. And then for those events, what's really great is the patient that's having the procedure done, after their procedure, they come out into the waiting area where everybody is. They sit down, they answer questions from the group, and we don't tell them what questions to ask, and they all always ask, was it painful? Um, what's your vision like now? How bad was your vision before? But it's really amazing because after that LASIK procedure, the first thing they do when they sit up from the bed is they look at the clock in the room and we have them read the clock and they can see it, they can see it where they couldn't see it before. So it's a really kind of a wow moment for the audience. But that's been really, really fantastic. And if we're having it at a location outside of the office and we're not doing a live LASIK procedure, or even with our cataract events in the past, we've had patients come that have had surgery done and talk about their experience.
Quick break brought to you by Boost Patients. If you're listening to this podcast, you're probably a physician, a practice admin, or maybe someone on the marketing team, and you really have a singular goal. You want new patients, more consults, higher surgery volume. And oftentimes, when you want that, you think immediately about marketing, spending more on marketing, investing more in marketing. Maybe, but probably not. We've mystery shopped over 600 practices, and there's one commonality with all of them. They're not very effective and not very good at patient follow-up. So before you invest more money in marketing and more into that investment, you really need to understand how your practice is following up with new patients. So go to boostpatients.com, fill out the contact us form, and let me know that you want us to mystery shop your practice. We'll mystery shop it. We'll document how your practice follows up with your new patient lanes, and we'll share that information with you. Now back to the show.
Yeah, those are the kinds of stories that more LASIK patients need to hear because that's what happens 99% of the time,
Right,
you know?
exactly.
And
Exactly.
like you're right. Unfortunately, we're against this whole negative media, social media, whatever it is,
Mhm.
for the past few years. And the reality is, for us that have been in the industry so long, and we're watching these procedures happen, people are most often than not having an amazing experience and having their life
Right.
changed. And so so when you do the outreach, how do you use that material for either site night events or LASIK? Like, do you use that in your external marketing? Like, do you use that in the cycles or like happy patient? Because when you have them all together,
Yeah.
you can maybe get reviews a little easier.
Yeah,
So,
we definitely use patient reviews in our marketing. We actually a few months ago just started this program called Atwal. Yeah, Atwal is the practice name, Atwal Eye Care,
mhm,
Atwal Icons, and that's for our vision correction patients. And if they, we talk to them before they're having surgery, and we tell them that we have this program. You get a little discount. It's like $150 off your surgery if you choose to participate. And it's what you promise to do is do a social media post prior to your procedure, and then you do one post procedure. And you tag us. You have to tag at All Eye Care. And this helps educate more people, right? Because they're doing these videos, they're tagging us, which all their friends see it. And then you get referrals based off of that. So that's been a
yeah,
really, really cool thing that we've started doing.
I like that. Yeah, because it's sometimes harder to get those happy patients to, once they're done,
Right.
go and tell people on social
Yeah.
media. So I think that's a great idea.
Yeah, and we're also the official eye care provider of the Buffalo Bills. So
Oh, nice.
we've done LASIK and vision correction procedures on a lot of the players. So
Okay.
when we do it on a player, we interview them before and after, and sometimes we even have the player at one of our events. So those are usually when I say if we have a larger event, we don't have it in the office.
Mhm.
Usually when you're going to have a player there, it's a
Yeah,
larger event because people want to
for
meet him.
sure.
But that's been great too with our marketing because we're really a huge football city. We're all behind our Buffalo Bills, so everybody wants to meet them. And again, you would think, well, you're just getting people there to meet the players. And sometimes you are, but they're also learning about your practice. So even if they're not a LASIK patient or a cataract patient or dry eye patient, they're learning about all the things that you offer. We have 5 locations. We have opticals at our locations. We treat. We do corneal surgeries. I mean, we do um, intravitreal injection. So it's just getting the patients in the door, and whether they become a patient or their family members do, it's really great outreach.
So as you're talking through it, I'm thinking, wow, that takes a lot of, I'm sure that's a lot of effort, planning. So do you have a whole team of people or a dedicated team that does this? Or is it you by yourself? Or like, who
Um,
does this?
well, it's as far as the marketing for it, we have a marketing team, and I have a social company that we work with. So they do all the digital, I have to approve them, but they do all the
Uh-huh.
digital ads and all the marketing. But as far as the events themselves, I do all of the planning, selecting the dates, and I start off the programs, and then the surgeon takes over for the Q&A session. But I've been doing them so long that it's sort of like, it's really, I try to have my calendar of events picked out for the next, what I learned is have them picked out for 3 to 4 months because when I first started doing them, I would just do them monthly. I would say, okay, this month we're doing it this day. And I learned that patients were calling and saying, well, I can't make that day. Do you have another one? And the staff would say, oh, that schedule will probably go out in a couple weeks. So now, since I roll it out 4 months in advance, patients are signed up or potential patients are signed up 3 months from now because they couldn't go to a couple. So they got on the schedule for one. Um, but now it's just like, it's just so simple because I have it down pat on this is what we do. And this is, I usually order food from the same restaurant. It's just all, very easy.
Easy says you. uh, and how frequently is that? So is it one a month, or are you doing
Yeah,
more?
so we do 3 or 4 events a month. So it's
Okay.
usually 1 or 2 cataract events. So if we do 2 cataract events, it's one with each of our 2 surgeons, and then a dry eye event, and then a vision correction event. So
Okay.
3 to 4 a month, which is usually
Okay.
almost one a week.
Okay. And then now I'm to the point of picking your brain because I'm trying to think, get ideas. So
Sure.
when you do your cataract lunch and learns, are they a typical certain day of the week or a certain time of day?
Yes, our cataract lunch and learns are usually at 11:30 a.m.
Uh-huh.
The surgeon finishes clinic a little bit early, and then he has surgery right after. So it's that sweet
Okay.
spot that we can get him up,
Okay.
and it's lunchtime, so they can
Sure.
enjoy their lunch at the appropriate time. And we usually do those on Wednesdays, and we've done them other days. We feel that Wednesday's the best day, mostly for the marketing part of it. Um, we found that when we have events on Tuesday or a Monday, they're not as well attended. And I think it's because of the weekend. Usually these events, you're not signing up for them months in advance, typically. You're usually signing up, we get the most signups within the
2 days.
7 to 10 days
Yeah.
before, even a couple days before. So we find when it's right after a weekend, that's not usually as well attended. So for cataracts, it's Wednesdays. For vision correction, it's Thursday, and that's because that's our vision correction day that we do our procedures. So we pick Thursdays, and the dry eye events are usually sometimes we do them on a Tuesday if we have to, or a Wednesday.
And that's all around lunchtime.
Yes, the dry eye is the sight nights are in the evening, so they're usually 6 p.m.
So when you do your modern vision correction, how do you market that? Because it could be a LASIK patient, it can be an RLE patient. You don't know. So how do you go about that?
Yeah. Um, like I said, we have some questions when they're scheduling. We market it saying modern vision correction options. Sometimes we'll say learn more about, watch a live LASIK procedure, learn more about EVO ICL and refractive lens exchange. So we'll, get the words out there at least to them. Um, some come in knowing I want EVO ICL. A lot of them have never even heard of it. But it gives them, they at least know we're going to talk about it.
Okay.
Um, and what we find is that many of the patients that sign up, because when they sign up, one of the questions we ask them is their age bracket. So we have, are you, 18 to 29? And then, we group them. So what we find is we have a lot of people over 50. And, those patients are either RLE or they're going to be cataract patients. They want to get out of their readers. So, but we know ahead of time. So we can kind of, I'll talk to the doctor ahead of time and say, okay, today we have, 70% are over 50, so we know kind of where to gear the conversation. We'll talk about all of the vision. We'll talk about LASIK, PRK, EVO ICL first. We'll
Mhm.
show the live LASIK procedure. And then in the Q&A, we'll talk about refractive lens exchange. And it's just organically, somebody will say, you know, I have a cataract, or they'll mention cataracts, or we'll know just by looking at them by their age that they may be a cataract patient. So the doctor will just talk about that. And he'll say, refractive lens exchange is like cataract surgery, but you don't have the cataract. So we'll talk a little bit about that, but we welcome all ages, as long as you're, 18 or over, because we don't want to do these procedures on younger patients. We're okay with the mix. We don't split them up. We kind of just talk about all the procedures because that person that's coming in for like an EVO ICL, their parent might have cataracts or might be frustrated with their reading glasses. So we're educating them on procedures that their loved ones might wanna think about undergoing.
Yeah. No, that's really good. I think that's great. So, where did this drive to do this come from? Was this something that you decided many years ago from your physician, an idea you had? Where did it come from?
We've always done it for vision correction as far back as I can remember, and I think, like I said, I think a lot of practices did this back in the day.
Hmm.
But then it was more recently, really with the inception of, not necessarily the premium IOLs, but when femto came available for cataract surgery. Um, there's so much to learn. You need to know. So now, do you want laser assisted or do you not? Do you have astigmatism? You might want a toric lens. Do you want a multifocal? With the addition of light adjustable lenses, there's just so much out there that we said, we have to cater to these cataract patients. It's too much information at one sitting for them. When we have our cataract evaluation patients come in for their appointment, they get everything done on the same day. So they have to be pre-educated. If they're not, it's very hard. I mean, not all of them leave with a decision. They're thinking about which option, but we feel pre-education is the best way to have that patient in the chair for as little chair time as possible with the surgeon. Um, and we also, besides the events, because not everybody comes to an event. So what happens with those patients? Our patients have a pre-appointment phone call. We actually use a company to do this. They reach out to our patient and they ask about their lifestyle issue. They talk about what a cataract is. So similar to what we do in one of our lunch and learns, they talk about what a cataract is. They talk about, do you know what lens options are out there? No. Okay, I'm going to talk to you about that. Talk about laser assisted surgery. They talk about financing. Um, you know, they'll ask the patient is if you had to pay out of pocket to reduce your dependency on glasses, is that something you're interested in doing? And they make notes in our EMR records. So when that patient comes in, we already have an idea of what they're thinking or at least what they've been educated on. So it just really helps that whole process of um, getting them in for the evaluation, them kind of understanding and knowing what options they're going to have available, and really does reduce the chair time with the surgeon.
Yeah, I think you're doing a great job of the education piece, which seems like the biggest challenge these days with
Right.
so much new technology, so many
Hmm.
options. You know, could you are you ICL? Are you on the border between that and LASIK? Are you, over 50? And it's just
Right.
how can the non ophthalmology person know what to do? And so education is critical. And I also think too that the surgeon making strong recommendations, because as the expert, this is what I would do if I were your family member, or I would recommend you do. Which it sounds like your surgeons are very connected to the education piece, and
Yes.
and then close that loop once, I'm guessing, once they come in the office of, okay, well, you've heard all these things.
Hmm.
Now this is where I think you should go.
Yeah, and the one thing is and the way our surgeons look at it and the way we look at it is these are educational events. We're not there to we are not there to convince a patient that the best technology is an advanced technology IOL because it
Mhm.
might not be for everybody, and some really are not even a candidate for some of the options. So we really just educate them. We have at every one of our events, we'll have somebody say, so if I just get the monofocal lens, then I'm not going to be happy. And the surgeon will say, you are going to be happy with whichever lens we put in your eye because we use the same platform of lenses. So the monofocal lens is the same platform. You're just going to have to wear glasses after. And if you're okay with that, and many patients come in and they say, my grandkids wouldn't recognize me without glasses. I want to wear glasses. Okay, well, that's okay. Then you do that. But what our surgeons do in the exam lane when they're meeting with those patients is, like I said, they have that information in front of them. So they're saying, "Oh, Mrs. Smith, I understand that you're an avid reader, or you like to do gardening. Do you like wearing glasses? Do you wear them now for reading? Those types of things."
Mhm.
And they hone in on that, and then they'll make their recommendation, and they'll say, "Well, you can definitely get the monofocal lenses. You'll need glasses after for this and that. If they have astigmatism, you'll need them for distance. You'll definitely need them for reading. But if you want to reduce your dependency, this is the lens that I would recommend for you." And another question we get a lot is, "Oh, well, okay, the light adjustable lens must be the best because it costs the most."
Mhm.
And we say, no, that doesn't mean it's the best. It means for us, it's, a lot of chair time, a lot of your surgeon, because our surgeons do the adjustments,
Mhm.
and that is worth something. So that's why it's the most expensive. Not that it's necessarily the best for you. We don't know that yet. So it's just really just, educating them on all the options and what they can expect afterwards. Because we do LASIK, if they're having their surgery with us, their cataract surgery, and they're having one of those options, one of those advanced technologies, if we need to touch them up with LASIK, that's included. Um, Not all practices in our area have LASIK offerings, but they're putting in these lenses, and we get those patients afterwards, and they're not happy, and then we're having to kind of fix that. So we do offer everything, which I think is another big plus with our practice.
So I'm a practice administrator and I'm listening to you talk and you make it sound so easy, but I'm a year in and I'm thinking, I want to do this. What are some key takeaways or some advice that you would give them? Where to start?
I would say, pick one educational event, whether it be vision correction, cataracts, dry eye, whatever it is you really want to focus on. Don't try doing them all, grabbing them all at the same time. I think from an educational standpoint, I think cataracts would be what I would focus on. And, you've got to think about, do you want it like more boutique style, like a fancier setting, or do you want it a large event, or do you have room in your practice to do it? Um, who's going to help with the event? What staff members are going to help? You want some staff ambassadors that are going to, be there for when those patients come in and they're checking in. So,
Mhm.
and then when they're leaving, we always have our counselors in the back of the room. So when the patients are leaving, I'll tell them you can schedule an evaluation at the front desk if you'd like. If you have more questions and you want to talk to one of our counselors, they're here available for you. You really want to get, you know, a team, even if it's a small team together, um, like I said, to kind of be your champion for this. And then it is once you found your location and found you can even as far as the what food you bring in, things like that.
Mhm.
Some of the companies will help sponsor that. We've had them at restaurants where if we are marketing and we're talking about that restaurant in our marketing, they're not going to charge us for the food, or they're going to charge less for the food. So there's
Sure.
lots of ways. If you're a new practice and you really think I can't afford to have an event, I I would say you can't afford not to, because they've been so successful. But you do have options to do that. And then your first event might be really, really, really small. So that's okay. I would say stick with it. You got to stick with it, 6 months, six events on the same topic, and it will grow. I'm convinced of that. And then make sure that you're um, tracking the patient. So when you have them sign up, we require their cell phone number and their email address. So that way, if they don't schedule, we now have a reach out for those patients. So we now can, we have them in our system. We're able to reach out to them in the future with any events or anything else that we want to um, talk to them about, but have it easy to schedule. So an online scheduling, or we have online, but we also, if they call in, we'll put them in as well. So
Mhm.
make it as easy as possible for them, and collect the information that's important to you. One of the questions we ask vision correction is, we'll ask, do you know if you have astigmatism? Do you know what your prescription is, um, those types of how long have you been thinking about having vision correction? Whatever questions you really would like to hone in on, ask those in your when they're scheduling that appointment through your online scheduler. And if you're not on social media or not strong with social media, you gotta that's one thing. Have that set up prior. If you're doing ads on TV, talk to your marketing team about putting a banner at the bottom that states when your next event is. You could just have a generic one that says, go to our site for our events. We have on our website, if you go to our website, the first thing that pops up on our website is a pop-up screen of our events for that month. So you can't get past it until that's going to be what pops up. So you want anyone going on your site to see those and then say, "Oh, wow, I didn't know that they did dry eye too. My wife suffers from that." And what one new thing that we're doing, we just actually did a trial run with our last vision correction event, but we're going to do it a real one. Our next event is we're offering it through a Zoom link as well. So they can, if they can't make the event, and the reason we thought to do this is our last event, we had a really large crowd planning to come, and then we had a lot of snow.
Mhm.
So it turned out to be a small crowd, which was okay. But we thought, why not have a virtual option too? So now on our question, one of the required fields is, would you like to attend in person or virtually? And if they attend virtually, we're going to send them that link. It's going to be live from our facility. Like I said, we did a practice run. So we had a camera in the LASIK room. We had a camera in the waiting room. So, we had somebody testing on the outside to make sure they could hear everything clearly. And it worked out great. So we're going to see how that works. But there's lots of little things you can do, but it really is very rewarding, and the people in the audience are just always so thankful afterward.
And how do you measure success? Is it how many people register, show up, schedule evals, have surgery?
Yeah, we do a few different things. So yeah, whenever we have somebody that schedules from an event, we have one of our Um, how did you find out about our office? One of them is to put that they came to a lunch and learn or a site night or whatever. So I could then track that. So in reporting, I could see, this many people came in and were educated, this many people for that event. And I do it even by event. So I could see, like, oh, okay, the outside one didn't do as well as the inside one. Um, and then, so how many converted to an evaluation? How many kept that evaluation appointment? And then how many converted to a procedure? And then the cost versus the reward, right? So how much did the event cost, which really is very minimal, and how much revenue did the practice earn from that person that came to that event and had something done? So it's, those are the key things that I really look at.
Well, Debbie, that was a ton of great information. I'm sure anyone listening will be very grateful for it. And I know a lot of people are doing these things, but I think more are probably not and need to do it or not doing it enough. And I think
Yeah.
all of us can share and take ideas from each other and hopefully continue to grow the business, grow education, and get patients coming back in for LASIK again, getting people feel comfortable.
Hmm.
And the cataract, obviously, demographic is one that we can continue to grow our businesses on because
Right.
that's definitely there.
Hmm.
So yeah, I appreciate you sharing all your wisdom and for coming on the show. Nice to meet you
Thank
virtually.
you. So nice to meet you. I'm happy to be here. Thank you for inviting me.
Awesome. And also want to take a moment to thank the guests for joining us today. If you enjoyed our conversation, please subscribe and don't forget to share it with your friends on social media. Another shout out to Boost Patients for producing the podcast. Boost helps ophthalmology practices get more new patients without spending a dime on marketing. You can learn more about them at their website at boostpatients.com. Until next time, have a great week.